Aging and Disability, My Perspective by Chantel Jones. What I believe is considered old and disabled. In my opinion, being old is not related to any age restriction or just growing older. Being old is a direct reflection of one's inability to do anything. It limits an individual's personal capabilities as well as reduces the level of efficiency and utilization of these capabilities. When we look at defining a person that has disability, that depends on the individual person. A person can be physically or mentally disabled. A mentally disabled person has setbacks due to impaired intellectual functions. This is a neural development disorder. Physically disabled limits a person's physical capabilities. Their mobility and stamina is impaired. For an example, if a person is disabled, he would not be able to walk without the help of an external assistance device. Aging and disability with generation changes and cultural differences. Understanding aging and disability from a generation standpoint, it is different from generation to generation. A 21-year-old may think that a person that is 40 years old is old based on their age and not their appearance. Whereas Generation X would look at someone that's in their 40s and not look at them as old. Visual appearance does not matter to Generation Z, age does. It is totally different now at the current time because I would consider people aging when they stop understanding the new technologies as well as the changing environment of the world. I think the first sign of a person aging is when they stop adapting to the culture which is being implemented into society. Best example is an old person unable to understand the usage of the internet. When we look at cultural differences, I think the idea is the same. The assessment based on aging is looked at the same for cultural differences. If someone is from a different culture, then the aging idea would be the same as it is in a general criteria, which I think applies to each and every culture. It doesn't alter my beliefs. I believe that with aging and disability, it all depends on how that culture handles a person that is aging or a person that is disabled. Caring for an aging or disabled family member. I think the responsible party that should be able to care for that person is an immediate family. A sister, a brother, mother, father, cousins, also caregivers. Family as caregivers are extremely important. The person going through the disability or the older person is looking at, they're more comfortable with someone that's family. I would consider family to be not defined by the same bloodline. I define it as people living together with a close relationship and maintaining a helpful environment for each other, as well as providing comfort, whether it's siblings, whether it's relatives, friends, or loved ones. Those are all considered part of a family. Let's take a closer look at disability. So my mom became very ill about 3 years ago. It left her bedbound and dependent on family to care for her. She went from being a very independent, vibrant person to someone who was now on a vent, had a feeding tube, and required around the clock care. Her sudden disability impacted our entire family, some more than others, due to the fact that she wanted to be at home and not placed in a facility. With a strong support system, my sisters and other family members pulled together to make sure she could be taken care of at home surrounded by loved ones. It was extremely difficult for me because I lived in another state and I couldn't be there, but I went home every weekend until she eventually passed. This became a stressor for my sister because she was now my mom's primary caregiver. So she was the one that was there around the clock. She was the one that had to learn how to suction a vent, how to administer meds through a feeding tube. So it became a lot. The three things that I feel provided important information on attitudes toward disabled individuals in America and their care are the negative attitude of the people towards disabled individuals, unemployment due to disability, caregivers that tend to behave negatively towards disabled family members after a long time, or the situation. I believe these are essential statistical factors because knowing the attitude of caregivers and employers in America towards the disabled may help to spread awareness and improve caretaking for such individuals and help them to understand that every individual, regardless of their weakness, has the right to live happily and be treated fairly. According to Hunt and Hunt, the unemployment rate for disabled individuals remains at 70% for the past decade. Many disabled advocates state that one of the primary issues to increased employment is the negative attitudes that employers and co-workers have about people with disabilities. Because of the negative stereotypes and the lack of accurate knowledge by these attitudes, people with disabilities can't get hired, be employed in a fairly challenging job, and advance their careers. When we look at caregiver burnout or stress, the National Alliance for Caregivers estimates that 23% of family caregivers caring for a loved one for 5 years or more report their health is fair to poor. Caregiving for a loved one can put extreme stress on someone. I know firsthand from my example I gave earlier. Caregivers start to neglect their own health, and 40 to 70% of family caregivers have clinically significant symptoms of depression, with approximately half of these caregivers meet the diagnostic criteria for major depression. I feel we as society can do better by addressing the social and healthcare needs for the disabled by improving healthcare access and human service, collecting disability data to help make decisions to aid in a better system. Another way is to reinforce the health and human service workforce capability. Include people with disabilities in public health programs and improve preparation and training for caregivers. Reducing disparities for individuals with disabilities can aid public health with improving health for all people in the United States.